It's officially the mid of the year and it's getting colder, but at NESHA Talks, we never fail to bring you another episode, and we are always joined by the doctor who gives us guidance free of charge consultation. Dr. Makemba, thank you always.
Thank you for having me, and we are going to be having another exciting one. And the idea is to keep it simple and plain,
Yes.
and get everybody informed and practical information that you can use at home.
We appreciate you, Doc, always giving that advice. And when we're sometimes, a bit hesitant, should we not?
Yeah.
One of those was under heated debate a couple of years ago. Doctor knows that.
Yeah.
But this edition, we're going to speak specifically about generic vaccinations. I think let's take it to the basics. What kinds of vaccinations are there, and what is the importance of a vaccination?
Vaccination, historically, how vaccinations were developed is that back in the 1920 and so forth, we had these plagues that were coming out, polio, smallpox. And what it used then to do is, once, there's an outbreak, a vast number of population get, sort of infected, and then there was a lot of life that has been lost. And the medical fraternity then engaged in understanding, and doing research, and realized there's a concept of herd immunity. For instance, if somebody get infected and then they develop antibody to an infectious agent, and the body sort of is able to subsequently fight it off. And then the medical minds of that time came together and decided, look and say, look, this very same organism that is causing the problem, if we deactivate it and put it in a state that it does not necessarily cause the disease, and inoculate it into people, the systems become primed. And when they are in a real life environment where they are exposed to the bugs or the pathogens, their system then are able to fight it off. Mm-hmm. So it was on that basis vaccines were created. And the idea was then once you vaccinate people, and if there's an outbreak of any kind, their system is then able to buffer off the infection that might come. Obviously, things change, but definitely that is the basis on which and why vaccines are developed, is to fight off the spread of diseases that has been a problem for centuries. And we have seen a lot of tremendous outcome in terms of, disease management, people not, getting infected. But over the period of time, a lot of things change, life is evolving, human beings are becoming smart. As to whether the concept is still the same, and it has been the same, that is subject to who is involved. Yeah, but that is definitely the basis as to why vaccines are definitely manufactured, is to help, fight off infection, priming up people so that when they get exposed to the real bug, they can fight it off. Yeah.
And Doc, giving an example, when you're born, you have those vaccination cards already. You already mentioned the mandatory ones to fight off those preventable diseases as well. What are some of those, like Doc mentioned, it's more like airborne diseases that are coming, they're going. How do you educate someone to say, in those difficult situations, what are those vaccinations that are really, really important to still use, or some vaccinations that you could probably, determine how would you react to it? It becomes difficult in this day and age, doesn't it, Doc?
Yeah, it's very tricky. The standardized one that we give to children that has been around for centuries, those we can probably vouch for.
Yeah.
We have seen the good it has done. And these little ones grow up to be healthy adults, functional, and not being in and out of hospitals all the time. Of recent time also, we have had, other outbreaks that came out, particularly COVID, so to say.
Yeah.
And then obviously a vaccine was produced. A lot of information was, given to the public. Some of the stuff were then, looked at conspiracy theories, and some of them, were sort of acceptable. And then as time progressed, we are seeing a lot of changes, and obviously evidence, to support or to be against, it's very difficult. Those that are at liberty to explain to us exactly, what unfolded are the manufacturers, unfortunately. We only go by the basis of why vaccines are produced in the first place. And, also medicine has evolved in how we practice medicine. Previously, it used to be, I'm the doctor on this side of the fence. You are the patient on that side. So whatever I give to you, I just shove it down your throat and you take it in. But it's now patient-centered. We are creating a doctor-patient relationship. Gone are the days where patients walk into our clinic and I just dish out stuff for them and say, go take this. They question you and they want to know, what are you giving to me? What are the possible side effects?
Yeah.
And that is the right way of practicing medicine. It's just that obviously back then it was probably not realized, First and foremost, as healthcare provider, we have no basis of forcing any product upon anybody. Whether we know that it's going to do them good, and they refuse to take it, it's their body after all. An individual has to be allowed to make that decision. And some vaccines are also seasonal. Let's say if you are traveling to an area that is known to have a challenge like yellow fever, for instance, you might be required by law to say, if you are going to that, space or geographical location for your own safety, take this vaccine. Some are prophylactic treatment, for instance, we give if you are going to a malaria area. Those are understandable, and those are not always given all the time. They can be given periodically. And if you never get to visit any of those regions, you don't even need to take them. Yeah. So the standardized one, probably see by far, it's in the pediatric population, is given to the children so that their immune system are primed up by the time they get to adult life. The immune system can recognize some of these bugs and fight it off. And then the newer ones that get developed as pandemics come up, those ones, the debate is very thorny. People are not always keen on taking them. There's a lot of vaccine hesitancy because of safety concerns. People they don't always have trust in the system. Historically also, if you look at the history of how humanity has evolved, with nations invading other nations, a particular group of population colonizing another group of population, and what people have been subjected to historically. People always do the introspect and say, if these folks did this to us 100
what can they do to us?
What can they do to us now?
Yeah.
So when people are concerned, their concerns are genuine. We need to understand where people are coming from. And we have to find a way to find each other halfway and get to understand. In that way, we're able to sort of, safeguard, and, encourage people to do the right thing. Yeah, so I personally, in our space at our clinic, I allow people to come in and, if they have questions on vaccines, they ask those questions that I can address them. And I must acknowledge I don't always have the answers. And also what people need to understand, particularly at our level, primary healthcare physicians or primary healthcare practitioners, I go based on the knowledge and the concept behind why something is done.
Yeah.
But there's no way I could know what the guy in a factory is doing. So if I give you information, it's based on what the concept behind, the product or the practice. But as to what the guy put in the product that ends up in your body, there's no way I could know that, unless I am part of the team that is in the factory manufacturing the product. Yeah. So, and obviously, the idea for our patients is to always do your own research as well, read up. And I encourage my patient, if you're not comfortable about something, it's okay, And obviously, there's always that gut feeling. If your gut feeling is telling you, hey, hang on a minute.
Follow it.
Yeah, follow it. Yeah.
And nowadays, Doc, I think, the younger generation, we research.
Yeah.
We have second thoughts about it because it's like my body, my choice,
Yeah.
my body, my right.
Yeah.
Which makes it a bit difficult too. But I mean, like Doctor said, those vaccines in the past and those that are now coming here, what are some of the side effects on some vaccines? Just to briefly mention a few.
Yeah, the basic things that we often, even with babies when they bring their little ones. If you get a little one a jab, the area where you injected, it might become a bit red, inflamed. The little one might develop a bit of a fever in the next 2 to 3 days. The little one might develop even an upset tummy, or start vomiting. Those are the basic stuff that we see on a daily basis. And those are self-limiting in a way that, it's not permanent side effect that you might have to live with.
Yeah.
But now you might have also seen, not only from the media, but also from some of the leading medical minds that are now coming out with evidence that maybe some of the newer products that we've been exposed to are proving to be causing maybe one problem or the other. And this is where it become a bit tricky now. Like I've said, me as a primary care practitioner, I might not always, understand what happens behind the scene when a product is produced. And if I encourage my patient to say, okay, the concept behind why you have to get vaccinated is A, B, and C. And if unfortunately the product was produced in a manner that is not always, safe to use, it becomes very difficult, because I don't have that information.
Yeah.
And I encourage my patients to follow their gut feelings.
Yeah.
If you don't feel comfortable about something, it's okay.
And it's always right.
Yeah, it's always
as
right.
long as you made the decision that you're happy with,
definitely.
that's what matters at the end.
Yeah, that's what matters at the end of the day, because after all, it's your body, and you have the right to question what gets to be taken inside your body.
Doc, with the health sector having so much in demand to educate, sensitize, strategize public information, how do healthcare givers, especially in the industry itself, disseminate this information, the factual information and the information that's really important for any patient out there?
Yeah, what we try to do, we have a health professions council.
Yeah.
Even in our setting here, the health professions council is supposed to be a body that also regulates the space. Especially on the social media platforms. Unfortunately, social media platforms don't always filter out information. Everybody can go up there and start rendering, a narrative. Even somebody that doesn't necessarily have a medical training background. What I always tell my patients as a yardstick to safeguard their decisions based on the information they are consuming is to say, first, watch the source. And do a background check. If it's an information given to you by somebody with no medical training, it might be true. There might be factual information to it, but run it by your healthcare provider, be it your doctor, be it your specialist, be it your nurse, and get a perspective of somebody that has been trained to say, I've read or I've heard, or this is some content that I came across. Do you vouch for this? Is this information true? Should I question this? Because in the end, if you make a decision based on any information given to you, whether wrong or right, unfortunately, some decisions you can't undo them. Yeah. So it's always best to make a decision, that is factually, verified, by, professionals, so that you safeguard the decision that you are making. Especially when it comes to healthcare, it's always about consuming medical products. And these medical products get to be consumed either through injection, through tablets. It goes in your body. It somehow get to interact with your body through all the physiological processes that take place. And unfortunately, if you consume something that might be harmful to you based on any information that you got from a source that is not credible, unfortunately, you might have to live with the side effects. Yeah.
Well, Doc, thank you for having credible information on the show. We appreciate you. And the next edition, we will be back with more.
Thank you for having me. And I look forward to more exciting, dynamic conversations in the future.
Great. There you have it, Dr. Nelson Makemba. It's these uncomfortable conversations, but like we always say, it's very necessary to have. If you have any comments, any suggestions, maybe even new topics for us to discuss, all you have to do is pop it in the comments section. We'll be back next time.